Hello, I'm Sarah Lester.
And I'm Deb Lester. Welcome to AEC Leadership Series, sponsored by Lester National.
We focus on AEC industry trends and how external factors influence our community. Today, we will be talking about those trends and how COVID-19 has impacted work routines and environmental routines.
Today, we have the pleasure and honor of speaking with Kip Edwards. Kip is well known in the healthcare industry with 44 years of leadership experience leading operations support, business, and clinical services in multi-facility integrated healthcare systems across the U.S., including Banner Health, California Pacific Medical Center, Kaiser Permanente, and the University of Michigan Hospitals. Go Blue! Kip is a popular feature speaker in health and industry summits, podcasts, and has been quoted as an industry expert in dozens of industry press, including American Builders Quarterly, American Healthcare Leader, and Facilities Net. Again, it's an honor to speak with Kip today. Hey, Kip, how are you?
Great. Pleasure to be here.
Well, thanks for being at the table with us today. We have a series of questions that both Sarah and I will be asking you. First of all, we are really interested in how COVID has kind of shifted the way, or has shifted the way business is being run. It's kind of first on everybody's mind these days. So for you, how has COVID-19 changed how you perform your job?
Well, like everybody, I immediately went to working at home, as did all of Banner Health that could. Now, a lot of Banner Health treats patients and works in hospitals. They didn't have that option. They had to stay on the job in a somewhat dangerous environment and continue to do what they were doing. But everybody that could go home went home and has continued to work from home and will continue to work from home probably well into next year until a vaccine is readily dispersed. When I think about it, though, it's kind of fun to think about what's changed because it's not all negative. Yes, we all miss the people we used to interact with. We miss being able to see them. But we've learned to see them through media like we have right now. I can see the two of you. And in some ways, we get in contact more often than we used to and closer, whether that's work-related or a glass of wine. I think we miss the personal connection in that sometimes at work, I'd be likely to walk down the hall and talk to my strategy and planning counterpart and just catch him for a quick conversation. Now it's got to be a very conscious phone call. So that's a little bit difficult. But we've learned to use the online media much better than we were 6 to 8 months ago. We were all fumbling around trying to get the picture on the right part of the screen and the documents go up. So I think we've learned there's less travel now, there's less commuting. So there's positives and negatives in the way this has changed.
Agreed, absolutely. No water cooler sort of banter, but it's still this opportunity to find new ways of communicating. And what do you think, has it affected your company's profitability? Do you think it's increased or decreased profitability?
That's a really good question for healthcare, and you'll get a lot of different answers. I have seen some articles published lately about large healthcare organizations that are doing very well right now from a net operating income standpoint. The revenue may be down, but since they have cut costs, it's balanced out. We were not really sure because there are several factors to that. There are some savings that we have achieved, like we're not going to lease as much space as we were going to, but we still have space that we were already tied into. But the reimbursement's pretty unclear. And in healthcare, quite frankly, we make the best part of our revenue off of surgical volume. And that had to be cut back, tailored back, and managed through this. And it's still being managed through this. So we haven't stopped elective surgeries, but sometimes we curtail them based on the volume of patients coming in. And the actual reimbursement for the COVID patients remains somewhat of an unknown. And they're very expensive patients to care for. They're long stays, requiring lots of care, lots of equipment. So overall, I'd say, yeah, it's impacted us financially. Where that's showing up right now, not just with Banner Health, who I'm very familiar with, but a lot of other healthcare organizations, you've seen them stop or postpone capital projects. And most are sitting and waiting right now, trying to decide, am I going to move ahead? What will I move ahead with next year? Because they're just not certain what this year is going to look like as it closes, and they're really still uncertain about next year. So they're all hedging their bets by kind of holding back on capital at the moment.
That's a really important point, especially in the AEC industry, looking at the future of this industry and when it'll start rebooting. Like when will they start looking at the capital infrastructure again? Well, they're just trying to manage the amount of patients they have running through. And then also the fact that the surgeries, elective surgeries, were part of the profitability. Wow.
Let me just add that the good news or bad news, depending on how you look at it, none of that demand has gone away. When you think of the projects, they have been postponed, but they have not gone away. We were already working with just the high priority capital needs, and I think that's pretty true throughout the industry. They're still there. So what I hate about these times where we postpone and stall things is the floodgate eventually opens again and we all get swamped with the work. That's the good news.
Well, so in the future, in fact, what's happening with the healthcare industry is people are understanding the need for, some being dynamic in the construction aspects of it in a way that they probably didn't even believe or understand before in the past. So that's a really good point. And how is Banner doing? What are they doing to kind of make working at COVID-19 environments more manageable?
Well, many things. And I think you have to look at different environments. I think you really have to start with the hospital environment, since that's where the most intensive treatment is happening. And the number one priority from day one has been to protect our staff. They are by far the most valuable, the most scarce commodity in all of this. I can go out and create thousands of beds. I can open tents, I can open arenas, we can build them all over the place, but we have a finite number of healthcare professionals to treat patients in those. So we knew from day one, we had to protect them. And high on that list was managing PPE, or personal protective equipment. Everybody knows the term now. In the beginning, it was managing the shortages, trying to figure out where we could get it. Then it evolved into managing the use, the right use in the right place, the right handling, and the training around that. And as you know, this virus is something we've continued to learn more and more about, and we're still learning about it. So that guidance continued to evolve up to and including today. So that's the first thing. So there's a lot of training of staff. There's a lot of work to upskill staff. So finding nurses and doctors that typically work in clinics or other places and be able to bring them into the hospital setting so we could care for the patient. So there's a great deal of work done around that. Limiting access to the hospitals, as difficult as that is, and I can tell you I have spent hours and hours on calls where we struggled over the concept of we can't let family members in to see their loved ones, or how can we let family members in to see their loved ones? How do we deal with an end of life situation? How do we deal with a new baby? How can the father be present for his baby being born? So figuring those things out took a great deal of planning. And again, they continue to adjust as we go along, but it's all directed towards, first and foremost, the safety of the healthcare professionals, because that's the best thing we can do to ensure that the care is available when it's needed. So that's the hospital. Clinics, adjustments in clinics. At first they shut down and really weren't seeing patients other than virtually. Then they've reopened, but they've reopened with precautions. There's sign-ins, there's checks, there's screenings, there's barriers. There's hand sanitizer about every 3 feet as you walk around any given facility. So they're able to function, but they're functioning with precautions. And then in the office and admin area, basically those have been shut down and have remained shut down. So all of those thousands of people are working from home. We were lucky in that we already had over 1,200 people working from home. It was a program we instituted several years ago. So we kind of knew how to do it. We knew which technology we needed to deploy. We knew which guidelines we needed to give, but it happened pretty quickly and people have adapted to it marvelously.
That's incredible. I mean, I was thinking about when you were speaking about these amazing the staff and just the frontline staff and then the people and how their mental well-being and not just their physical well-being, but how they're so on the front lines, and we just are so we are so grateful to them, and that your job being where you are is to really think about them a lot and how they can best be supported across the board. And so it's a very big job. And when do you see, or how do you see the industry, especially the Banner Health, how do you see them adapting, or how do you see them shifting in the future because of COVID-19? Do you think there's going to be a different way of working in the future as we go forward?
Yes, yes, and no. I think several things will change. One, this is my estimate. I think 30% of the people who used to work in an office setting probably will never go back to that office setting. They'll continue to work at home. And that's just kind of a wild guess. That could be 30, it could be 45, it could be 25, but there's a large number of people that we've now discovered don't necessarily need to have an assigned office space. They need to have a work environment that works for them, so they have to be supported at home, as well as when they do need to come in, have a place they can work. A pretty graphic example of that was just before COVID, we were searching for a 100,000 square foot office to lease for a group. We've canceled that. We've determined we don't need that anymore. In fact, we probably will have excess space when the time comes. Clinics, I think, will change. So clinics were mostly done in person. There were very few virtual visits pre-COVID. We have now gotten up to close to 60 to 70% of our visits done virtually.
Wow.
Over an iPhone. And that's not just using your normal software that's on the iPhone, by the way. It has to be secure, it has to be billable. There's all sorts of things that had to occur. It wasn't as simple as say, just FaceTime me and I'll give you an exam. So that work went into place. I don't think it'll stay that high, but I think after post-COVID, it's likely to drop back to maybe 30% of the future visits. And there's a lot of pluses in that. People can tend to things quicker than they might have otherwise. If you say, I got to go into a doctor's office, I'll put that off. I'm going to wait and see if I'm really dying before I do that. And then you wait longer, you get sicker, and then you go, versus something you could handle in a call today from the comfort of your home or your office and deal with it quicker. So there's some good health pluses in that as well. So, those are some of the differences I think we'll see in the future. It will be different. Hospital care won't change a lot, but I've been working with a national group on new hospital standards. Kind of triggered by COVID, but once we got into that, we actually started dealing not just with COVID, we started thinking about COVID, forest fires, big deal where you live, earthquakes, hurricanes, and just go down the list of all the things we've experienced this year, and said we need to maybe revamp our guidelines and standards for hospital facilities and how we provide for these. Some of it might drive physical changes, some of it just to create different procedures. How do you close off a front entrance when you need to and stop admitting visitors? Hospitals are designed to enter from all over the place. It's really hard to isolate them. So a great deal of work of that sort is already underway.
Wow, that's really interesting. I mean, the new hospital standards is something we wouldn't have thought about, but it's definitely going to be something. We're looking at the world through new eyes, I think, through COVID, and it's extraordinarily helpful. It's kind of maybe it's a fast forward on some of the things that could have happened by looking through these glasses, the COVID glasses. So
I hate to say it, but for years we've done our best work on emergency preparedness immediately post-disaster.
During an emergency.
In the case, you have about a 1-year window when it's fresh, and that's when you got to make your gains. And then people it fades from the memory and they move on.
some people feel that COVID's not going away for a while, and our COVID attitude, the mask wearing, et cetera. And you were speaking, and this will be my last question before I hand it off to Sarah. You said, when do you think the construction, that you recognize that there's going to be new facility construction and there's on the books and ready to go? When do you think those things will start? Is it 2022 again, or when do you think that'll start rolling forward as an industry person?
Well, that's really varied by the healthcare organization. Banner Health, we really didn't stop much. Mostly what we stopped were projects that we did not feel we could continue with and maintain the safety of the staff or the construction workers by continuing the project. They were too close of proximity. We actually kept most everything else going. Others have completely stopped projects, but they're sitting there partially constructed, and they're gonna need to move them ahead. And I think that answer really will come as they look at the financial impacts, what the financial performance has been, taking into account some of the incentives that have been paid as part of COVID, and being able to bring all of the numbers back together. So that answer is really going to vary from now, I'd say, to middle of next year. I don't think anybody can completely stall much longer than that, because there's just, some of these are very important. Some of these are safety related. Some of these are regulatory related. Some of these create capacity to deliver the care that we need right now. So I don't think we can wait a whole lot longer than that.
That's great to know, actually, that maybe in 2021, middle in 2021, some of these other things will be starting up again construction-wise. So Sarah?
All right. So my first question for you is about technology. I know that telehealth has made leaps and bounds during the pandemic out of necessity. So I want you to talk about that a little more. How effective has Banner been in integrating innovative technology into the day-to-day work routine of company personnel?
That's a great question. That's been one of the most amazing stories. The telehealth group was part of the overall operations team that I reported to, so I got to see some of it firsthand. And what I saw happen is I saw them take a 3-year plan for implementing telehealth and compress it into almost 30 days.
Wow.
Because we needed it. We needed the capability to do the virtual visits. We needed the capability to visit patients in the hospital. We needed the capability to do mental health visits virtually, and ED referrals. A lot of it we had already, and so we knew it's a good thing. So for years we've operated something called the EICU, electronic ICU. There's a team of doctors and nurses that actually sit off in another building, and they monitor all of the ICU patients, almost in the entire company, in Torrington, Wyoming, in Worland, Wyoming, or in one of the larger medical centers here. So they're constantly monitoring, and what they're able to do is quite often they'll see a change in a patient before the nursing staff on the floor can see it, because they're running software that monitors their physiological parameters, and it'll pop up as something they should look at, and they'll start looking at it. They can actually talk to that patient, and they can talk to the nurse that's caring for that patient. It has saved hundreds of lives. Wow. So that's something that's been going on for a long time, but now we're adding all these other capabilities and adding them faster, a lot faster than we would have otherwise. Now that was an investment. You know, they didn't come free, but basically just said, we don't care what it costs, we need it now. And I think one of the most significant one is the ability to do virtual outpatient visits.
Yeah, that is incredible that you have been able to expedite that process, because it has been so necessary just for the pandemic to have all these virtual visits. People are getting, urgent care virtual visits. They're going to their doctor online. So this is so important that we were able to do this. I'm happy we were able to do this. Another question I have are kind of shifting to AEC industry. Do you believe that AEC industry members are doing everything they need to meet the dynamic and expansive demand clients are asking of their consultants?
I think so. Actually, I think they've done a great job. And in fact, we've learned things as a result of it. So We had many major projects in motion, some in early planning stages, some in design, and these are multi-$100 million projects, some in construction. Now, the ones in construction, they basically had to continue, and the contractors were very quick to adopt safety precautions to monitor, screen, space people out within the project, bunches of hand washing. You go look at their lunch areas that they set up, and all of a sudden, all of the picnic tables were kind of blocked off, so you couldn't have people crowded together. So they jumped on that pretty quickly and did a great job. Where we were all nervous was we were just used to doing design meetings, planning meetings in person to get a bunch of people around a table, including some of our operations team, nurses, doctors, others, and have them all there and point at drawings and point at things on the screen. And we were really wondering if we could keep that going. And we have. We've been able to do them virtually because we simply were not going to bring people together unless they have, for meetings like that. So we learned to do it virtually, and it's kind of worked. And I think the plus there is the AEC industry is one that's global right now. For years, we've seen firms that did work for us locally. They had people locally, but we knew that, as the day changed and the time changed, that work moved around the globe sometimes and then came back for our daytime. So they've been doing that for a while. I think for me, I've become far more receptive to firms that might not be in the immediate vicinity to be able to work on our projects, where before we wanted them right down the block so they could run down and meet in person. So I think this again has given us some experience, and a positive experience that we can build on and utilize, and opens up the ability for new relationships that we might not have taken advantage of in the past.
Mm-hmm. Yeah, it's incredible how the AEC industry has adapted so quickly. And that's what I've heard a lot, is that the pandemic has made the world a lot smaller. People are able to work together that might have not necessarily wanted to work before, just because of geographic difference. And so that is a plus side. And now my last question to you is, the AEC industry traditionally has had less representation of women in the industry. And so I'm wondering about, for Banner, how far away is Banner from having a female CEO? What is the senior most position a female holds in your organization?
Okay, no, that's a great question. Healthcare for many years has had a great representation of female leadership and female senior leadership. It's just very natural. I can think back, and I think my boss has been a woman probably as far back, many times that I can remember. Exactly when Banner Health will have a female president and CEO, well, I know our current president and CEO will be retiring in some number of years, maybe. Some say Peter Fine will never retire and he'll work, into infinity. But reality, he probably will. So there certainly will be an opportunity there. Right now, the next two kind of senior people in the organization, one was my boss, the chief operating officer. So Becky Kuhn was responsible for all Banner operations across the country, everything: hospital, clinic, surgery centers, urgent care, everything we operated fell into her purview. So she would be one of the next senior. And the other person I would mention is Dr. Bessel, who's our chief medical officer. So Marjorie Bessel has been the chief medical officer now for several years. So you see a lot of women at the top. And I started looking around our division presidents. 1 out of the 3 are women, is a woman. Then I looked at our hospital CEOs across the country, and about 2/3 of them are women right now. So there's a great deal. And I guess what I would say, I don't really think about it anymore. I mean, it's been so common for me. I don't think, well, that's a woman and that's a man and I report to. It's just healthcare. It's the team we work with, and it's the way it's been.
Yeah, that's great. I'm happy that women are so represented in healthcare. One of the purposes of this leadership podcast is to uplift, in addition to talking about AEC trends, is to uplift female voices in the AEC there'll be more episodes on that. But yeah, I'm happy to hear that women are so represented in healthcare. And so those are all the questions.
Oh, you just went still on us, so we'll pick up.
There she is.
There you are.
Am I back?
Yes, you're back.
Okay, well, those are all the questions we have for you. Unless, Deb, do you have any other questions that you want to ask?
I'm just really grateful to have you here, Kip, with us today. And Sarah and I have so enjoyed hearing about how, how you are as a leader, of how you feel COVID's going to be or is affecting the industry. And you are just, you are a leader, and we are definitely honored to have you be and participate on this this opportunity. So.
Well, thank you. That's been my pleasure. And for full disclosure, I'm a retired leader.
We'll see about that.
Yeah.
Thank you so much, Kip.
My pleasure.
All right, you can learn more about these podcast leadership series on lusterwellness.com in the future. Thank you so much for attending. Bye.